So I have the pleasure of introducing our first speaker, Dr. Deepa Camenga, who will be presenting the topic, JUUL, Vaping and Electronic Cigarettes, a Public Health Crisis. She is an assistant professor of emergency medicine and pediatrics at the Yale School of Medicine, and she's board certified in pediatrics and in addiction medicine. Her research is supported by the National Institute on Drug Abuse and focuses on improving practices around the identification and treatment of tobacco and substance use disorders in adolescents and adults. As a practicing pediatrician, she treats patients both in the primary care setting and in subspecialty medicine addiction clinics. She was the recent co-chair of the of the Academic Pediatric Association's Tobacco Special Interest Group and is a member of the American Academy of Pediatrics Committee on Substance Use and Prevention. Please join me in welcoming Dr. Deepa Camenga.
Hello, good morning. Thank you so much for the opportunity to speak today at the AAPNC. Today I will be speaking about something I'm seeing every day in my office. I'm a general pediatrician, as was mentioned, seeing it both there and as well in my substance use treatment practice. And that is one of the leading public health issues that is affecting teens in our country today. Today I'm going to be talking about JUUL, vaping, and electronic cigarettes. And I'll explain to you why I think it is an emerging public health crisis. We will be talking about tobacco products today, so it's very important for me to mention I do not have any conflicts to disclose, do not intend to discuss unapproved use of any product or device in this presentation. So on September 8th, 2018, the Food and Drug Administration Commissioner, Dr. Scott Gottlieb, issued the following statement. Dr. Gottlieb is tasked with regulating tobacco products in the United States, and he issued this statement in response to federal data about electronic cigarette use rates in teens. We have an obligation to act on what we know, and what we know is very, very disturbing. Kids' use of e-cigarettes has reached an epidemic level of growth. So this leads us to ask, why would they put out a statement saying that e-cigarette use has reached an epidemic level of growth? Well, what we know is this. In 2017, 11.7% of high school students used e-cigarettes in the past month. Since about 2015, e-cigarettes are now the most popular tobacco product used by adolescents in the United States. They have surpassed cigarettes and are now the most popular tobacco product used by teens in this country. And perhaps, most alarmingly, preliminary federal data that was reported in the Wall Street Journal suggests that rates of use may have increased 75% from 2017 to 2018. If confirmed, this would translate into an increase in the prevalence of e-cigarette use from about 11.7% last year to an alarming 20% in just 1 year. It increased from 11.7% to 20% in 1 year. What that would translate, if confirmed for us in our offices, is that 1 in 5 of our teen patients potentially may be using e-cigarettes. So e-cigarettes are sometimes referred to in the literature as electronic nicotine delivery systems, and I have up here some examples of some of these devices. E-cigarettes actually comprise a number of devices. They come in many different shapes and sizes and colors, as you can see, and they also have a lot of different names. So we have cigalikes, which are shown on the far right, and these are so-called first-generation products, meaning these were some of the first products to enter our US market. They can look like and resemble cigarettes. We have vape pens. We have mods and advanced personal vaporizers, and these are products that allow users to change the e-liquids and sometimes the batteries, customizing the temperature of the device. There are products which are electronic nicotine delivery systems that look like cigars and pipes that you can see there. And most recently, we have the emergence of these products called pod systems. And that's a picture that I took of one of them. That's the JUUL device. And there are other brands such as Fix and Storm. These are newer electronic nicotine delivery systems, and they are unique because they are small and discreet. They also can resemble everyday items. For example, the JUUL shown here resembles a USB. Now, what these devices share is they have the ability to serve as a delivery system for nicotine. The e-liquids are the liquids contained inside the device. You may see them advertised under different names. Sometimes they're called e-juice or vape juice. Regardless, they're comprised of a number of ingredients. First is nicotine. The e-liquids are labeled with a variety of strengths of nicotine. You will see the label say anything from 0 to 59 or more milligrams per ml. It should be noted that the e-liquids currently are not highly regulated, and although they may be labeled to have 0 milligrams per ml of nicotine, studies have shown that this does not translate into actually having that amount, and there have been measured amounts of nicotine in products labeled at 0 milligrams of nicotine. The e-liquids also contain propylene glycol and vegetable glycerin, and this is the solvent in which the other ingredients are dissolved. These two constituents have been designated by the FDA as being safe, generally recognized as safe for ingestion, but to date we don't really know how they affect safety when they are inhaled. And perhaps most importantly to us, a very common and appealing ingredient in these e-liquids are the flavorings. As of 2014, there were 7,500 different flavors available on the market. Now, the flavors come in many different names. Some are descriptive of the taste. So shown here is a flavor berry white. But some of them, such as the flavor shown here, unicorn milk, it's clever, but perhaps not as descriptive of what is contained inside. So scientists have gone on to characterize the actual tastes that are available in these flavors, and these are the categories that they found. So some of the flavors taste like fruit, they're desserts flavors or sweet flavors. Some of the e-liquids taste like tobacco. There are others that taste like menthol or mint, and others that taste like other palatable items such as alcohol, coffee, tea, and other beverages. Of note, unflavored e-liquids are available on the market. Now, studies have shown that youth, and this is not surprising, tend to like, prefer, and sometimes tend to use these fruit, dessert, and sweet flavors. And this has led some to be very concerned that it is the availability of these sweet flavors that has contributed to the epidemic rise in use rates among teens in the US. Some also are concerned that it is the development of these pod systems that has contributed to the growth in use of these products among teens. As I said, one example of a pod system is JUUL. Again, there are other brand names available. These are unique products in several different ways. One is that these products, the pod systems, JUUL in particular, contains e-liquids with very high levels of nicotine. They're labeled on the package at about 5% nicotine. This translates to about 59 milligrams per ml. So based on the available e-liquid strengths on the market, these pod systems have some of the higher labeled nicotine concentrations. Another aspect of these products are unique. They have a discrete number of flavors, but there are flavors there which we do think appeal to youth, such as fruit, mango, and mint. And as a result, these products, anecdotally, in my practice and other pediatricians have told me, are commonly used among teens. And in fact, last week in tobacco control, there was some new data, and it was a 2018 national probability survey of 15 to 17-year-olds in the US. And what they reported is that 10% of these youth have ever tried the JUUL. Now, the popularity of these pod systems products is also supported by sales data. Shown here is a paper published in JAMA, which shows that the sales of the pod system devices, and you can see especially those from JUUL Laboratory, have exponentially grown in the past 3 years. It should be noted that also large tobacco companies are producing e-cigarette products. You can also see from here that British American Tobacco and Altria have also experienced a high level of growth during the same time period. So taken together, and given this current landscape of tobacco use among youth, I hope to cover 3 objectives that will help inform our practice as pediatricians. Today, I hope to discuss the known and potential risks of e-cigarettes, vape devices, and pod systems, such as JUUL, review methods to screen and counsel patients and families, and I'll show you some resources which are available to help patients understand the potential risks of using these products. Today, I will review 4 risks. The first is the risk that is seen with the association between the use of e-cigarettes and the initiation of combustible tobacco products. I will review the risk of nicotine addiction, safety risks, and what is known currently about the long-term health risks associated with use of e-cigarettes. This 2000 study, published in JAMA Pediatrics, was one of the seminal studies demonstrating the association between initial use of e-cigarettes and subsequent cigarette smoking among adolescents and young adults. What we see here is a meta-analysis of 7 longitudinal studies of youth. And what this study found is that ever e-cigarette users, as compared to never e-cigarette users, have 3.5 times increased odds of cigarette smoking initiation. It was this study and others which led the National Academies of Science in their 2018 report, Public Health Consequences of E-Cigarettes, to make the following conclusion. There is substantial evidence that e-cigarette use increases risk of ever using combustible tobacco products among youth and young adults. And the second point I want to bring up is the risk of e-cigarette use and nicotine addiction. The adolescent brain is uniquely vulnerable to the rewarding effects of nicotine. Preclinical studies show that adolescents, as compared to adults, are more sensitive to the rewarding effects of nicotine, and they also experience less aversive withdrawal symptoms. So what this means is that being exposed to nicotine as an adolescent is a very pleasurable experience. Studies have also shown that e-cigarettes can deliver higher levels of nicotine than traditional cigarettes. In particular, as I said, there is concern with the pod system e-liquids, again, some of the higher nicotine concentrations available on the market. And a recent study of youth showed that, unfortunately, of young JUUL users, 63% of them did not know that the product always contains nicotine. And this suggests that young people may be misinformed about what is actually contained in their e-cigarette products. Another aspect of e-cigarettes that makes it particularly rewarding is that there are nicotine salts present in certain types of e-liquids. So what this means is that whereas most nicotine is delivered in tobacco products in a free-base form, a nicotine salt refers to a protonated compound of nicotine. In this case, in some products, it's the addition of benzoic acid to the free-base form of nicotine. So it is hypothesized that what this does is lower the pH of the nicotine, and therefore it may allow nicotine to be delivered at high concentrations with minimal aversive effects in the human, meaning minimal throat irritation. Now, this is particularly concerning because it may allow novice and young users to be exposed to very high levels of nicotine without aversive effects. There are also known safety risks associated with electronic cigarette devices, including burns and poisonings. A recent study showed over 2,000 explosion and burn injuries, that is both to the skin, including the eye, seen in US emergency departments from 2015 to 17. Another study showed over 8,000 liquid nicotine exposures reported among children less than 6 from 2012 to 2017. However, recent legislation that was supported by the AAP that requires child-resistant packaging for e-liquids has been associated with decreasing exposure rates among these young populations. So looking towards the future, the largest concern is what the long-term health impact will be of e-cigarette use among our population. The National Academy's report also makes this conclusion. There is conclusive evidence that in addition to nicotine, most e-cigarette products contain and emit numerous potentially toxic substances. However, the health effects of these emission of these toxic substances is not completely understood at this time. There is evidence, which was published in the National Academy's report, that completely switching to e-cigarettes from cigarettes reduces exposure to toxicants and carcinogens. So this means there is evidence to show the human body has less toxicants and carcinogens when it switches from cigarettes to e-cigarettes. And this is among adult smokers. However, there are still concerns. There are concerns with the long-term health effects of inhalation of ultrafine particles deep into the lung. There are still ongoing concerns with exposure to heavy metals in e-cigarette aerosol, nickel, lead, and tin. These have all been measured in the aerosol. And of course, there are concerns with exposure to volatile organic compounds. So given all these risks and the state of the science as it exists now, how do we screen and counsel our patients? So I put forth 2 expert recommendations that we can use in our offices now to help us communicate these risks to our patients. So the first one I'm going to talk about is how to include e-cigarette terminology in our tobacco screening. I'm also going to talk about ways we can help educate our patients and families about the health risks of e-cigarettes. So first thing, when we're asking and screening for e-cigarette use, we have to ask the right questions. Some teens may not consider an e-cigarette product an e-cigarette. They may consider it something else. So in your practice, you may want to consider asking about specific products. And this is especially relevant to the product JUUL. There is some evidence that teens who use JUUL do not consider themselves to be using an e-cigarette product. So you may want to ask specifically, do you use e-cigs, vapes, or JUULs? And in your area, you'll see what the common products are, and you may want to include that terminology in your tobacco screening. Doing this may allow you to more accurately identify those teens who are starting to use these products. It is also important to understand that when teens describe the behavior of using an e-cigarette, they may not say, I'm using an e-cigarette. They may describe it as vaping. And as has been reported, there is also a terminology of JUULing, which refers to using a JUUL product. So we may need to ask about the behavior in different ways in order to get accurate information. So once we screen, regardless of whether the person screens positive or not, we need to educate patients and families about the health risks of these products. But before we begin, we have to appreciate that many of our patients are seeing and hearing many positive messages about e-cigarettes. E-cigarette advertising is abundant. In this study published in the MMWR, it said that 7 in 10 teens were exposed to e-cigarette advertisements in 2016. Advertisements are present in many venues. 68% of them saw them in retail stores, 40% online, including social media sites, 38% on television, and 24% in newspapers or magazines. Now, these advertisements, and these are pulled from the UCSF industry document library, can be very provocative and alluring for teens. And it's not really surprising that these advertising techniques are persuasive. It's recently been shown that receptivity to e-cigarette advertising, meaning that teens identify that they like an advertisement and they can recall an advertisement, is associated with trying e-cigarettes, and it has also been shown to be associated with trying cigarettes in the future. So again, our teens are seeing a lot of positive messages in their environments about e-cigarettes. So when we speak with our patients about these products, we have to remember to be honest, respectful of what they know, but we also have to understand that they're very interested, most likely, in learning. And it's our job, really, to share the science about what we know about the health risks. And this is what the science states. This is the opening sentence from the report of the Surgeon General in 2016, e-cigarette use among youth and young adults. And it states, Tobacco use among youth and young adults in any form, including e-cigarettes, is not safe. We need to share this message with our patients. Tobacco use in any form, including e-cigarettes, is not safe. Nicotine is very common in e-cigarettes. Many people, as I said, may misunderstand that nicotine is present in their products, but it is very common in e-cigarette products. And nicotine can harm the developing brain. The brain keeps developing about till the age 25. We need to share this message with our adolescents and young adults. Nicotine can harm their brain. And how does it do it? Nicotine can cause addiction. This is well shown. This means addiction to both nicotine itself, and nicotine exposure in adolescence has also been associated with the development of addiction to other drugs in the future. Other things to share with our patients. Scientists are still learning about the long-term health effects of these products. There are a lot of messages that they are safe for use for smoking cessation. That has not been empirically validated yet. We are still learning about the long-term effects of e-cigarettes. Some of the ingredients in e-cigarettes can be harmful to the body. In particular, we're actively studying how it deals with the lung. Other things to share. Defective e-cigarette batteries have caused burns and explosions. And for adult patients, it's important to share that children and adults both have been poisoned by swallowing, breathing, or absorbing e-cigarette liquids. Adults should be keeping liquids away from young children. Resources are available on the site ecigarettes.surgeongeneral.gov. Surgeon General has put forth a great effort along with the FDA and the CDC to help educate the public about the risks of e-cigarettes in teens. And there you'll find handouts both for teens, parents, and there are handouts available for healthcare professionals as well. Another great resource available to us is the AAP Richmond Center, which is hosted on aap.org. There you will find resources about how pediatricians can talk to their patients about JUUL, as well as information about the health risks of a variety of tobacco products. So in summary, back to Dr. Scott Gottlieb, we have an obligation to act on what we know. And what we know is this. E-cigarettes are the most common tobacco product used by adolescents. There are substantial risks associated with trying e-cigarettes. And therefore us, we have a role in this. We can screen our patients for tobacco exposure, include e-cigarette terminology in our tobacco screening. And we can educate patients and families about the health risks of these products. It is through this important work that we may prevent an entire generation of our patients from experiencing the undue harm of tobacco use. Thank you very much.